Hi, I'm Rachel Dallmann. I'm the Director of Patient Financial Services here at Phelps Memorial Health Center. I've been at Phelps 12 years. I started in billing. I've been in the leadership role for about 4 years. Shelley and I began working together in January of 2018. Once I met her, I knew I could see the wealth of information she had, and we built that relationship very quickly early on. She was always there with the information I needed. She was very patient, understanding. She broke things down where I could understand it, and she has taught me more than she will ever know. Shelley has not only helped my career here at Phelps Memorial, and made me a better leader in that respect, but she's also helped me professionally develop. So those first few months was a whirlwind of information for myself and for my patient accounting lead, Maggie. We knew what the revenue cycle was. We knew what it contained. We knew the team players it had contained, but we never really brought those team players together. It was patient financial services and health information management. They were two separate teams, and we didn't have that camaraderie, I think, until Shelley came and really identified that for us. And that's what that revenue cycle kickoff meeting was about, was bringing those two teams together and saying, hey, we are one big team. Like, we have a huge job here at Phelps Memorial, and it takes both of our teams to come together to do that. And I think really that's what that did, was open everyone's eyes to, this is much bigger than just us. It's a lot of players, and we all have to be working together for it to work successfully. We never really measured our metrics the way we should have. Overall, from a 360 view, we did, but Shelley really taught me how to dig deep and find where the issues lied, in the nooks and the crannies of the revenue cycle. One thing that she did was brought a lot of metrics that we could measure, and we spent a lot of time building a spreadsheet that we update every month, so we know exactly what gross AR is, net AR, our self-pay ratio, bad debt, charity care, all of those things that we should have been measuring. And we probably were, but I wasn't. And she brought that to me. So that was huge. One area that I knew needed a lot of focus was our follow-up. And she really gave us a lot of tips and tricks on how to really break that down, measure it, and make it attainable so that we could make those numbers much better, which ultimately helps our bottom line here at the hospital and makes us financially stable, and gives us the opportunity to do the construction projects that we've done and grow the way we have. That's the bottom line. It's helped us be successful. By the end of 2019, we got our revenue cycle pretty much like the flywheel. I mean, it was spinning pretty continuous. So then this year, we're working on the managed care support piece, where they've taken our contracts with insurance payers and really analyzed the data, and they're putting together educational packets for my staff. So we know the payments coming in are correct, and we know we're getting paid what we should, and we're able to push it back on the insurance companies and what to do if they're not giving us what we need. The expertise that ruralMED has on that revenue cycle team is beyond anything that you could ask for. They are an extension of PMHC. I know, and my team knows, that we can call on Shelley and Dixie and Haley anytime we need to. It's easy as an email. They're very quick to respond with answers or suggestions on things, because they've seen some things that we haven't seen. And they do the same with us. So I really feel there's a working relationship there, and it benefits both teams. I would recommend Shelley and her team of experts to help anyone rejuvenate their revenue cycle.